Good morning, my friends at O'Farrell. We're going to be going over the medical benefits. I'm going to share my screen. Guess I should introduce myself first. I'm George Valdez with Financial Designs. If you're new, you might not know me, but we've been doing the benefits for O'Farrell for a number of years now. And we just want to share with you the way the benefit plan works. And the GAP plan, for those of you that have been there for a while, it's basically a review. So let me go there now and pull up the medical benefits. And basically we have this program right here with Neighborhood Health Partnership, which is owned by United Healthcare. We have this second HMO plan, which is an upgrade, and the cost is higher. And you will see that in your enrollment package. And then we have the GAP insurance, which will cover up to $5,000 if you sleep in the hospital or $2,500 for outpatient services. So most of the people are on the base plan. I think maybe we have just one person on this upgraded plan. And the copays are as follows. So we have 25 primary, 50 specialists. Everything is covered 100% thereafter. We do have virtual visits for a zero copay. You can download the app called My UHC from the App Store, and there you'll have access to FaceTiming a doctor. Pharmacy map pops up, and they will email the pharmacy script to your pharmacy so that you can basically, you have a sore throat or something minor, go pick up your antibiotics 10 minutes from calling, and the cost is a whopping zero, so that's a great thing. You wanted to go to a mini clinic like the CVS's or the Targets where you see a nurse practitioner face-to-face. It's the same co-payment as the primary, so same $25 as you see there. And then for emergency room, the deductible does apply. The deductible is $5,000, and we have for emergency room visits up to $2,500. So if you have the GAP insurance and you go to the emergency room, the GAP will cover the first $2,500. You will be responsible for anything higher than $2,500, but under the $5,000 deductible where United begins to cover. But ER visits usually average about $3,000, so it shouldn't be far more than $500. So I strongly urge us to use the urgent care, which is only a $50 copayment. And there, if we have the GAP, obviously that will cover the urgent care copayment, and the responsibility would be zero. If I sleep in the hospital, it shows I have a $500 copayment after the deductible. If I have the GAP, the $5,000 is covered. I only have to pay the $500. If I do not have the GAP, I will be responsible for the $5,500, including the deductible and the copayment, and everything will be covered at 100% thereafter. If I have any outpatient surgeries, we have on the GAP side up to $2,500 for any outpatient surgeries. If the surgery is, say, $4,000, then the first $2,500 will be covered by the GAP. United will actually never pay any of it because we haven't exceeded the $5,000 threshold in our example. So a $4,000 outpatient surgery, if you have the GAP, will end up costing you $1,500, which is simply the $4,000 cost minus the $2,500 the GAP pays. If we have any x-rays and or laboratories, those are covered at 100% with the office visit copayments, so no need to use the GAP there. And then MRIs and CAT scans, the deductible does apply. The cost of an MRI or a CAT scan is usually $2,000, but with our discounts is as low as $500. So if you have the GAP, that would be zero. If not, it's going to be about $400 or $500 for an MRI or a CAT scan. And then the co-insurance is 100%. So it fully covers everything after the $5,000. And the out-of-pocket is $6,850. What that means is that if I go to the hospital and I'm going to specialists and I'm buying prescription drugs, the total of all of those costs cannot exceed $68.50 in a calendar year. There are no referrals required, and the prescription drug does cover brand names now. So it's a 10 generic, 60 brand name, 150 the specialty medications. Let me get rid of this. 150 the specialty medications and 300 for specialty medication. Now it says no Walgreens. We got a better price as a result of having a deal, I guess, with CVS. So we can buy prescriptions anywhere pretty much but Walgreens. Okay, so make sure that we use this plan right so that we don't have any issues. And I will be seeing you very shortly on a dental and vision recording.